This video will demonstrate the proper way and procedure to taking skinfold measurements. Skinfold measurements are used to determine the amount of subcutaneous fat and the fat located directly below the skin. For this video, we will focus on 7 skinfold sites: the abdominal, triceps, chest or pectoral, mid-axillary, subscapular, suprailiac, and the mid-thigh. For these measurements, you will need a skinfold caliper. This technique is based on the assumption that approximately 1/3 of the total body fat is located subcutaneously, and the amount of subcutaneous fat is proportional to the body fat. However, these assumptions may vary with sex, age, and ethnicity, which introduce some error into the prediction of percentage body fat from the skinfold measurements. Other factors that may contribute to the measurement error include poor technique and/or unexperienced evaluator, and extremely obese and extremely lean clients, and improperly calibrated calipers. The accuracy of predicting the percentage body fat from skinfolds is plus minus 3.5%. All measurements should be made on the right side of the body with the subject standing upright. Calipers should be placed directly on the skin surface, 1 cm away from the thumb and the finger, perpendicular to the skinfold, and halfway between the crest and the base of the fold. The pin should be maintained while reading the caliper. Wait 1 to 2 seconds, no longer, before reading the caliper. Take a duplicate measure at each site and retest the duplicate measurements are not within 1 to 2 millimeters. Rotate throughout the measurement sites or allow time to the skin to regain the normal texture and thickness. For the abdominal site, it is a vertical fold 2 cm to the right side of the umbilicus. For the triceps site, it's a vertical fold on the posterior midline of the upper arm, halfway between the acromion and the olecranon process, with the arm held freely on the side of the body. For the chest site, it is different for men and for women. For men, it is a diagonal fold, 1/2 distance between the anterior axillary line and the nipple, and for women it's 1/3 of the distance between the anterior axillary line and the nipple. For the mid-axillary, it's a vertical fold on the mid-axillary line at the level of the scaphoid process and the sternum. An alternate method is a horizontal fold taken on the level of the scaphoid sternal border in the mid-axillary line. For the subscapular site, it is a diagonal fold at a 45-degree angle, 1 to 2 cm below the inferior angle of the scapula. If the participant's scapular line is not visible, you may ask the participant to put his arm in a bent position behind his back. This will expose the inferior border of the scapula. For the suprailiac site, it's a diagonal fold in the line with a natural angle with the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. For the thigh, it is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease, or the hip. Once you have all 7 sites recorded, the next step would be to calculate the participant's body density. You will need to add all the recordings of the 7 sites and plug it into the following formula. Keep in mind that it is different for both men and for women. For women, you will also need to add all the recordings of the 7 sites and calculate with this formula. Also keep in mind that there is a standard estimate error of plus or minus 3.5%. Once you have calculated the body density of your participant, the next step will be to calculate the body fat percentage, and you may do this by calculating or plugging it into the Seery equation or the Brozek equation for body fat percentage.